Utilitarianism and Euthanasia, Ethical View on Assisted Suicide. Introduction. The issue of euthanasia is heatedly debated in many circles of our society. The stakeholders include patients, physicians, legislators, representatives of various religions, the press, and the general public. As it stands, there is no consensus on the matter, as some claim that the right to pass away with dignity is a right, while others fear the consequences for society might be too great. However, there are many ethical theories through which one can perceive the issue. This essay aims to answer the question, does utilitarianism support euthanasia? Further, this paper will use felicific calculus to explore the utilitarian view on euthanasia. The utilitarian view on euthanasia. The end of life is associated with various disabilities and illnesses, some of which prove to be terminal. According to Hughes and Smith, the majority of deaths in elderly patients are attributed to chronic diseases of the heart, lungs, and other vital areas of the body. In many cases, sustaining the patient alive requires numerous medications to sedate the pain, which frequently causes even more adverse side effects. Palliative care is a necessity to remedy a patient's suffering, but it is often not enough and places a heavy financial burden on the family of the patient. The cost of palliative care for a patient exceeds $30,000 a year, whereas the yearly income of an average family in America is around $50,000. Thus, prolonging the life of a patient with a terminal disease is associated with physical and psychological suffering for both the patient and the family, as well as with economic difficulties further down the road. Utilitarianism supports euthanasia because alleviating the suffering provides greater amounts of immediate and long-term net good for the patient and their family. The Bentham Utilitarian Calculus. Bentham's felicific calculus is a tool that can be used to estimate the amount of net goods received from any given action by analyzing various factors involved. The process of using it involves considering several variables, which are as follows: the strength of pleasure, intensity, duration, likelihood of pleasure occurring, the propinquity of pleasure, the probability of follow-up sensations, purity, lack of negative feedback, extent. If applied to euthanasia, Bentham's felicific calculus can provide a picture of the effects that are anticipated as the result of the intervention. For the patient, the calculus would be as follows: the strength of pleasure, great; duration, short-term; likelihood of pleasure occurring, very high; the propinquity of pleasure, immediate; the probability of follow-up sensations, none; purity, absolute; extent, patients, physicians, family members. As it is possible to see, euthanasia offers an escape for the patient in chronic and unmanageable pain. From a utilitarian perspective, healthcare, as an industry created to promote health and minimize suffering, should endorse euthanasia. Conclusion. According to Garcia, Bentham urged that morality is not a matter of pleasing God, nor is it a matter of faithfulness to abstract rules. It is a matter of making life on the planet better by maximizing pleasure and reducing the amount of pain in the most consistent way possible. Euthanasia brings the most net good to patients suffering from painful terminal diseases. Although families may experience grief from losing a relative sooner than later, the total net good for them would also exceed their suffering in the midterm and long-term perspective.